All right, so we're going to go ahead and do some introductions. You know, we've got 16 sections here, so we have a lot of faculty, and we have a lot of people to keep up with, and it's hard to kind of keep up with who's already here. It's even harder to keep up with the new folks, and that's why we wanted to have a time where everybody could get to know each other, spend some time visiting. We've got, this is our organization chart, and most everybody has seen this, where we've got all the divisions. And I will say that since I took over as chair about 20 months ago, we only have one business manager who was here when I started. So we've had a lot of turnover, a lot of new business managers, new admins, people shifting around, and I think we're about to settle in and hit our stride and get to really taking off. So I've been real proud with the work everyone's done to kind of reorganize. These are our divisions and your business managers, and many divisions, and all of you have logos now. So if you want new logos for your letterheads, et cetera, Tasha can get all that for you. But Tasha's been amazing in getting all this done. And we want to welcome the new faculty. That's the reason we're here. Make sure everybody can put a name with a face. All right, so Dr. Albaba has joined us from cardiology. He's an electrophysiologist. We are trying to expand electrophysiology into the community, getting out to Monroe and Alexandria and promoting here. And he's also heart failure trained, and so we're going to kind of tap him on both sides. But electrophysiology is his passion. That's what we're trying to get him into. And welcome Dr. Albaba to the Division of Cardiology. Been here about 6 months already. Haven't quit. Dr. Sidakula is our heart failure specialist. He is going to revive our heart failure program. We had actually have a pretty thriving inpatient heart failure program, inpatient outpatient heart failure program, and due to a variety of reasons that has kind of fallen off. And heart failure is one of our top 2 admitting diagnoses to the hospital. Y'all know the amount of morbidity and mortality that goes into heart failure, and Dr. Sidakula, along with Dr. Albaba, are going to try to revive our heart failure program and try to mitigate a lot of that. Dr. Gonzalez is joined said she may have a hard time getting here. She's got clinical responsibilities right now, and her clinic's off-site, so hard time joining. This has been a big deal since Dr. Haas left. We were left without dermatology, and it's a big, big hole in our program. We're so blessed to have her, and she's already getting so busy that we're looking at APPs or another physician to add to her section, and we knew that was going to happen. So her schedule is getting really busy. Also, a lot of students and residents wanting to rotate over with her, and we're trying to get, as I showed you, our org charts kind of moved around, trying to get her a lot of admin help so she can get those folks over there. I know residents and students looking to get with her. She's been amazing already in helping our students who are trying to match into dermatology this year, navigate the match. The derm match, if many of you don't know, is kind of a unique animal, and she's been very helpful with that. She's very accommodating. Also, we'll come over and see consults in the hospital, and our consult residents are helping her with documentation and whatnot to make that be facilitated. Dr. Cedra Hassan is joined with GI, and she is fulfilling a very vital role as hepatology. Many of our GI guys love to scope and do not like getting office consults for elevated LFTs and transaminases and transaminitis. And she, fortunately, is passionate about that and is handling a lot of that for us, taking the heat off of our other GI guys. Our new GI faculty can get in the endoscopy suite and get those scopes done. So you got abnormal LFTs, you don't know why, or you need some help. They keep changing the name of NASH, but send those patients over. She's passionate about helping those folks. There's actually some stuff we can do for that now. So Dr. Hassan joining GI. Staying in GI, Dr. Sarab Daeed has joined and has already ramped up his endoscopy volumes, helping Dr. Kai out and Dr. Pandit out in the endo suite, doing general GI, doing inpatient consults, clinic, and fantastic addition. Dr. Naba Saeed has joined in GI as well, also doing general GI, but has a passion for women's health, and we're going to try to get her involved as her practice evolves We've got Dr. Modi doing cardio OB. Well, there's a lot of GI associated with OB and women's health, and so we're going to start, as Dr. Saeed, we're going to allow her to get in here and get acclimated, and we're going to start moving her over to get into women's health as well. Passionate about all of GI, but has a particular desire to get into women's health. Dr. Diraj Poza joins us in hospital medicine. Fantastic addition. Has already been active in hospital medicine and is just jumping on board committee service in the hospital, and also will be teaching residents and students. Dr. Hamza Khan, our third Muhammad Khan within the Department of Medicine, so use those middle names. Y'all know Harris already, and Dr. Taya Khan is our nocturnist, so be careful on emails and secure chats. But Hamza is joined in like. Dr. Poza has been very active already in committee service and trying to jump in with both feet. Dr. Priscilla Ozua joined, trained down the road in East Texas, and so comes over and joins hospital medicine. And she just got here, worked for a couple of weeks, and then had her third child. So she's been very busy taking care of new babies and joining us with hospital medicine. And Dr. Daniel Raza, most of y'all know Dr. Raza was here as one of our residents and joined hospital medicine here, and has an interest in fellowship down the road. Dr. Elin Arif is joining infectious disease. We really needed some help. We've expanded OPAC clinic. We've expanded inpatient and outpatient ID, and those guys were drowning. So this came at a good time, and already clinically active. Is going to be very active, I think, in teaching and research as well. Drew Patel. It's kind of interesting introducing Drew as a new guy, but because he's been here, everybody remembers Drew from his hospital days, and now we're introducing him as a new guy right before he leaves to go out fourth. But he's served as our junior faculty and fourth-year chief. Been an excellent addition to our residency leadership team, and has really kind of helped stabilize outpatient medicine for the IM program. Dr. Anam joining in nephrology, again, familiar face, trained here, and has really stabilized along with Dr. Morissetti, our interventional nephrology. We were down to two interventional nephrologists. If Dr. Morissetti had left, he decided to stay. We get Dr. Anam. Now we're covering all of IN here, expanded to Monroe. These guys are putting in ports for HEMONC in Monroe. These guys are putting in, they go over and do 10, 12, 15 cases in Monroe in a day, and have really stepped up. Any of you are having trouble with tunnel dialysis catheters or just getting access on these folks, man, they're always really helpful. I've seen them jump into on the procedure team and say, man, I can help. We'll run that patient around to AG. We'll throw that line in for you. These guys are amazing. Dr. Dylan Harrell, another familiar face, interventional pulmonary, doing interventional pulmonology and bronchoscopy, also general pulm and critical care. Is a man of many talents, local guy, again, familiar with us, and we're blessed to have you here doing some things that are not done everywhere. I think we take for granted interventional pulmonology here, but I think he and Dr. Holliday are doing some things that are just not done all over the place. And endobronchial ultrasound and biopsies and stent placement, things that save some surgeries. Dr. Kulkarni, another familiar face, transitioned from hospital medicine faculty, had already done pulmonary. Now, Dr. Kulkarni is med psych, so he is medicine, pulmonary, psych, and now critical care, okay? So if you're crazy and in the ICU, he's your guy, all right? He can come handle everything. Man of many talents. Also runs our POCUS thing. Man, we're so blessed that he not only has been here for so long, but decided to go the extra mile, get that critical care, and be able to integrate into the critical care call schedule as well. So we didn't get a slide made because we weren't sure if he was going to be here, but Dr. Shashank Singham is also with us. Thanks and welcome. Dr. Singham is returning, actually going to be starting up our bone marrow transplant program again. Very exciting. Okay, now when I was a resident, we had bone marrow transplant here, but it was way different. Okay, we didn't have a lot of stem cells. It was all allogeneic bone marrow transplant. We had to go do harvest. We also did a ton of bone marrow biopsies. Flow cytometry kind of changed a lot of that. And so, now as we move forward with bone marrow transplant and CAR T, that's something we haven't had here. We had to send CAR T patients away. He's going to be integral in getting that started. And so we are going to be the center, the hub, the only place that has that for a long way around. And if you have a leukemia and you're in this area, we're going to be gravitating right here. He's really going to be a rock star for us. We're about to send him off to New Orleans for a little while to get him integrated into their program so that we can exchange information, exchange patients back and forth. Welcome, big addition. Also, his wife will be joining us in the hemonc section as well. So we like keeping it in the family. All right. So to all these attendings, I would say welcome. I want to have a time where you can go around, mingle, meet each other. We like having fresh faces and names. Get your name and face out there. Let everybody know who you are. Better to get referrals. And welcome to everyone.